policy makes a lot of conflicts between the people. It makes a lot of war on the micro and the macro level. I think it's very important that vaccinated and non-vaccinated, they have to make friendship again. They have to keep together. They don't have to fight with each other. We have to come out of here together. And for this, it's important to keep the peace.
Mukesh Kapila is an emeritus professor of global health and humanitarian affairs at the University of Manchester, and he joins us now live from Geneva. Thank you so much, Professor, for joining us here on the NewsHour. Now, people are clearly angry. They're angry that they have been dealing with this pandemic, its repercussions, and further restrictions that have overwhelmed, whether it be their personal lives, the economies of the countries they live in. But there's still a risk, especially in Europe, where the WHO has currently announced it as the epidemic. Why is Europe having such a hard time in bringing down its infection rate?
Well, the science is quite clear. Large regions of Europe still have very low immunization rates. And as a consequence, there is breakthrough infections taking place. And we also know that many European countries were at the forefront of the vaccination campaigns earlier in the year, and their immunity is waning. So in scientific terms, it's not unexpected that there is a wave of the coronavirus going around Europe. But fundamentally, this is a problem of unvaccinated people. If you get vaccinated, then you're unlikely to be very sick, and you're unlikely to die from it. So, but the dilemma for policymakers is to balance the rights of individuals and the rights of communities. And remember, in Europe, the echoes of fascism and the Second World War are still with us. You mentioned Austria. Well, Austria is where Adolf Hitler was born. Mm-hmm. And countries are very, very aware of anything that impedes on their fundamental rights and freedoms.
Right.
It raises the dilemma. Whether what more important is it health more important or your basic freedoms or rights that are important?
Right. So if not enough people get vaccinated across Europe, we're going to witness this vicious cycle of infections rising and lockdowns being imposed.
Absolutely. There isn't a shortcut to this. And I think governments need to be much more patient at educating people. And also we have to do something much more in terms of countering the misinformation and that is going on out there. I mean, I don't understand. A continent that is so educated should be at the epicenter of the epidemic of fake information about both COVID and vaccinations against it. Mm-hmm. And that, I think, much more needs to be done on that than is being done at the moment.
Right. So in some parts of the world, like in Europe, people aren't getting vaccinated by choice. But in other parts of the world, like in Africa, people aren't getting vaccinated because they don't have the supply. When we look at the bigger picture here, how crucial is it for global health that a sufficient amount of vials are sent to developing countries?
Well, it's even worse than that. The spare stocks in the Western countries, including Europe and North America, they're being destroyed because they're past their expiry date. I think what's happening in individual rich countries is a microcosm of what is happening in the world as a whole, combination of all those factors. And absolutely, I think it is a disgrace that immunization rates are so low in developing countries in Africa and elsewhere because of supply side constraints. And I think this is going to mean that as a global pandemic, we are still going to be having this conversation probably 12 to 18 months from now. That's why it's important to do something more about it individually and collectively.
All right. Professor Mukesh Kapila, thank you so much for joining us on the NewsHour and sharing that insight with us.